Probably one of the most frequent questions I get asked is about medications to stop before surgery. And this is really important. There are a lot of people on a lot of different medications, and a big part of the optimization before surgery is working with your primary care doctor, cardiologist, endocrinologist, whomever it may be, to really determine the right time to stop medications before surgery and then when to resume them after surgery. So in general, when we have blood thinners or anticoagulation medication, this is really critical. When you're making an incision and you're doing a surgery, especially a major surgery like joint replacement, it's important to balance the risks and benefits of staying on that medication and stopping it so that we decrease the risk of bleeding, blood clot, hematoma, which is a collection of blood after surgery, and wound complications. Typically, for an anticoagulation medication, things like Eliquis or Xarelto or even aspirin, we typically say 7 days before surgery you should stop that. And we always work with the cardiologist or the prescribing provider, but in general, that's a safe number. For some people with advanced conditions, we may cheat that a little bit, but again, we'd work with your prescriber to do that. A very common medication that almost everybody with arthritis is on is an anti-inflammatory or a non-steroidal anti-inflammatory, an NSAID, things like ibuprofen, Motrin, Aleve, any of those, even prescription ones, we typically recommend you stop those 7 days before surgery. There are several reasons why, but one of them is that it can increase your risk of bleeding, and we want to prevent that. That being said, Tylenol or acetaminophen is a little bit different and will typically let you stay on that all the way up until the time of surgery. So that's an exception to the rule with those. Another exception in many cases could be Celebrex. This is a little bit of a different type of an NSAID, and it works with a different mechanism. So in some cases, you may be told it's okay to stay on that right up until surgery. Again, we'd want to check with your provider, but typically if it's okay, we'll keep that on a little bit longer. Herbal supplements. This is like the bane of my existence. This is a tough discussion. I'm a guy who takes a lot of supplements, but at the same time, it's really difficult to regulate that because they're all very different in terms of combinations, in terms of dosing, purity, and all types of things. So what I would say is, in general, most supplements you would stop before surgery, and working with your primary care provider and even your orthopedic surgeon to weigh in on that. Some of them can increase the risk of bleeding. Some can affect other organ systems like your heart, your liver, your kidneys, things like that. So very important to understand what you're taking. Make sure to disclose that, because a lot of times we don't think of supplements as a medication, but they are, and they can affect these things. And it's important to understand that before surgery. I think a safe rule of thumb, if you haven't either disclosed a supplement, whether it's an herbal supplement, a vitamin, a nutraceutical, in general, if you stop that 7 days before surgery, for the most part, that should be safe.